The research conducted by the Uganda Virus Research Institute and International AIDS Vaccine Initiative was released ahead of the World AIDS Day on Wednesday. It indicates a 28.2% HIV prevalence rate among fishing communities against the national rate of 6.4%. These prevalence rates that cover men and women working in the fish landing sites are likely to be higher over time, given that these people live in the same risky environment and are also often linked through sexual networks.
There are all sorts of entertainment, bars, sex workers around. So when after fishing, because they know when they go to the lake, it is risky, drowning, they come and relax and enjoy a bit.
Different HIV strands were also found in these communities that are often marginalized. More research is underway to see if there are dual infections in the communities.
The type of HIV we see is the HIV that we see in other populations. But we noted that we see also viruses that are recombining. Again, we see this in other populations.
A large number of people residing in these fishing communities have a negative attitude towards HIV to an extent that they are much more afraid of drowning as opposed to contracting HIV. Now this puts them at a very high risk of contracting the disease. This poses serious challenges to the researchers who are now finding ways of rolling out HIV services like voluntary counseling and testing, VCT services, as well as hospital referrals.
The men don't like mixing with the women in the clinics. So for the men, we had to get them like along the shores as they were preparing their nets, or we had to get them in the bars when they are resting.
The research is aimed at designing measures to prevent HIV infection in the fishing communities, and this can be achieved by addressing the largely risky male behavior, which is thought to be related to occupational factors. Craig Kadoda, NTV Tonight.